Vitamin D is an oil-soluble vitamin that has several important functions in the body. It helps to absorb dietary calcium and phosphorus from the intestines. It suppresses the release of parathyroid hormone, a hormone that causes bone resorption. Through these actions, vitamin D promotes bone health. Vitamin D have other benefits, such as improving muscle and immune function. Who are at risk for a vitamin D deficiency? People who spend most or all of their time indoors. People who have medical problems such as celiac disease that make it hard for them to absorb vitamin D. And those with osteoporosis, which makes bones weak and break a bone too easily. Vitamin D is made in the skin under the influence of sunlight. The amount of sunlight needed to synthesize adequate amounts of vitamin D varies depending upon the person's age, skin color, sun exposure, and underlying medical problems. The production of vitamin D from the skin decreases with age. In addition, people who have darker skin need more sun exposure to produce adequate amounts of vitamin D, especially during the winter months. The main reasons for low levels of vitamin D are lack of vitamin D in the diet, inability to absorb vitamin D from the intestines, and inability to process vitamin D due to kidney or liver disease. Examples of these include celiac disease, Crohn's disease, and cystic fibrosis. Surgery that removes or bypasses portions of the stomach or intestines can also lead to low vitamin D levels such as gastric bypass. People with chronic kidney and liver disease are at increased risk of low active vitamin D levels because they have decreased levels of enzymes that change vitamin D from sun-exposed skin or food to the biologically active form of vitamin D. The most serious complications of vitamin D deficiency are low blood calcium, low blood phosphate, rickets, softening of the bones during childhood, and osteomalacia, softening of the bones in adults. Vitamin D insufficiency is often associated with osteopenia or osteoporosis, an increased risk of falls, and possibly fractures, all of which can seriously affect a person's quality of life. Identifying and treating vitamin D insufficiency is important to maintain bone strength. Treatment may improve the health of other body systems, such as the immune, muscular, and cardiovascular systems. During treatment for vitamin D deficiency, it is important to have foods and drinks with calcium such as milk, yogurt, orange juice, tofu, cottage cheese, yogurt, soy milk, beans, dark, leafy green vegetables, almonds and orange. Other important sources of vitamin D are fatty fish, salmon, mackerel, tuna fish, cod liver oil, and eggs. In the US, fortified cow's milk is the largest source of dietary vitamin D. Side effects of vitamin D are uncommon unless the level becomes very elevated and the person is taking high-dose calcium supplements. High blood calcium levels or kidney stones can develop. Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.